Hello and welcome to Benchmark Organization Cybersecurity Policy and Executive Summary by me, Charles Lieb. The objectives of this summary are to compile previous information and include the following: the processes of the creation and/or changes to different types of standards, the organization's NIST cybersecurity framework, alignment to specific standards, functional areas, implementation tiers, and profiles, cybersecurity lifecycle, cybersecurity framework, and methodologies to establish a cybersecurity program that supports the organization's strategic initiatives, the organization's security policy, how it supports the business objectives, the organization's systems and network diagram, the organization's risk assessment, business impact analysis, and a business continuity plan. Compare and contrast different types of standards, including laws, regulations, policies, voluntary, and framework-based standards, the incident response and incident handling plan, cybersecurity awareness infographic, and finally, an executive summary. The process for creation and/or changes to different standards. We will be covering NIST and ISO in this situation. NIST, or National Institute of Standards and Technology, is comprised of 5 primary steps. The first being identify. This function assists in developing an understanding to manage cybersecurity risks to the system, people, assets, data, and capabilities. The next function is to protect. This function outlines appropriate safeguards to ensure delivery of critical infrastructure services. The next function is detect. This function defines the appropriate activities to identify the occurrence of a cybersecurity event. The next function is respond. This function includes appropriate activities to take regarding a detected cybersecurity incident. And the last function is recover. This function identifies appropriate activities to maintain plans for resilience and to restore capabilities or services that were impaired due to a cybersecurity incident. Finally, we move on to ISO, or International Organization for Standardization. It stands as an international body of standards to maintain at least a minimum level of security and is held at high regards in most countries. Here we cover the organization's NIST cybersecurity framework. It has the same steps but much more information. Firstly, we identify. We gather all information about the assets and how to protect them. Then we protect. Back up all systems, train staff, implement antivirus software, and various other elements. Thirdly, we detect. Watch all the systems and use various methods to filter information, such as a firewall. Then we perform penetration testing regularly. Then we respond. We update policies and retrain where needed. Finally, we recover. After verifying their security, use backups where needed and restore the facility to running order as quickly as possible. Here we cover the organization's security policy and how it supports the business objectives. Firstly, cybersecurity and proper internet use training for all staff. Training staff on how to use the internet and what to avoid is very important. If they find strange links, they may click on them and introduce dangers into the network, which could damage other networks as well. Regularly update passwords. Passwords are important, but a simple one can be figured out very easily with basic software. And information leaks as well, which means that people's information and passwords may be out there. If someone reuses a password commonly, they can very easily be figured out and they can get into our systems. The best way for us to counteract that is to change passwords monthly, ensure that they are complex, including at least 1 digit and 1 special character. And to maximize this, we can have the passwords be a minimum of 22 digits in length. The employees should not write down their passwords in their phones, as if their phones get hacked, then the information would be available. They may, however, keep a paper copy of the information. Then we move on to two-factor authentication. This ensures that only the individual who is supposed to be logging in is actually logging in. Then we limit access to according to position in the organization. This limiting prevents a major issue from taking over the entire organization, regardless of how or why the issue occurred. Penetration testing should be done often. This is probably the best way to ensure a safe system. very similar to a bulletproof vest with bullets. Not only does it show what to fix, but it also provides a proof of concept. Only the use of approved devices is allowed for staff on the primary network. Approved devices are important because an employee may accidentally or purposely infect the system with a virus or malware of some type. If the device is known, however, we can easily track down, stop, and maybe even prevent the issue. Personal devices may be used on guest Wi-Fi. The use of personal devices will always be present within our culture, whether or not we want it or not. So allowing them to have some place to use this is perfectly fine, but we must inform them that there is a less security within that network. Here we cover the organization's systems and network diagram. This is a diagram of Augusta Medical Hospital's network design. This design includes many elements, including cloud storage, internet access, 3 separate routers, one going from the internet to the firewall, then to the DMZ, another connecting to the IDS and IPS, then to the email server and a load balancer, and the last router is connected to the DMZ and then to the couple of servers. This design also has a switch and allows thin clients. The organization's risk assessment, business impact analysis, and business continuity plan. Risk assessment to find all risks that can possibly occur. This includes any known bad actors that may have ill intent towards organizations and their patients. BIA, deduce what impact the known risks could have on the organization and its systems. And finally, the BCP, keep the facility up or get the system up and running as soon as possible. The organization is a hospital after all, and people could die if this happens. So keeping the facility running is the primary goal after caring for patients. Compare and contrast different types of standards. ISO 27001, keep technology up to date. Servers should exist without vulnerabilities, and the organization has to be audited after a specific amount of time. PCI DSS, Payment Card Industry Data Security Standards. This applies to most credit and debit card companies and anyone who accepts forms of payment from said companies. It basically means that all personal information of the cardholders must be kept confidential. And HIPAA, Health Insurance Portability and Accountability Act, protects patients' information from being revealed to anyone they have not agreed to seeing the information who is not a medical required physician. The incident response. Step 1. Incident identification. Define what is an event. This could include things like slow internet and lag, or it may not. Step 2. Incident logging. Properly log and track all incidents, including what system, what user, when, where, and how. Step 3. Incident categorization. Categories must be assigned to make all data easier to find. This helps to also identify patterns of attack. Step 4. Incident prioritization. Each incident must be given a level of priority. If it can endanger someone, for instance, it will be given the highest level of priority. If it just slows down the servers, it's much more likely to give a lower level of priority. Incident handling. First, identify the issue, then report it to management immediately, and do not touch anything at all. Cybersecurity team will respond and handle the situation. If bad actors are found, then the team needs to follow the BCP and report the incident to the federal government. Tampering with anything that could be considered evidence is not allowed and can be considered illegal. The Cybersecurity Awareness Infographic. This infographic pertains to Augusta Medical Hospital. It covers information on the top 10 OWASP results. This is designed to help educate employees and be a type of guideline to help them get through their training in regard to the now required cybersecurity training. This is a continuation of the same infographic from the last slide. Executive Summary. Augusta Medical Hospital is here for its patients first. But in order to accomplish this, the facility and network must be secure. This document covers the basics of that security. We are committed to following NIST and ISO guidelines. Compliance is required at all times. By following our cybersecurity guidelines, we make it easier to follow HIPAA and other privacy laws as well. And finally, here we see the sources of the information that I found. Thank you all, and have a nice day.